Thank you so much for taking the time to speak with me today, Dr. Upasani. I am interested in exploring how healthcare and public health intersect for the immigrant and displaced populations. And your background in both internal medicine and public health is incredibly valuable for this perspective. I just have a few questions on this topic, and I'll keep it brief to respect your time.
Hi, Marcus. Thanks for having me. Just as a quick background about me for your audience, my name is Dr. Priyanka Upasani. I recently graduated from the Lake Erie College of Osteopathic Medicine with my doctorate in osteopathic medicine and my master's in public health. I'm currently pursuing my internal medicine residency at the St. Luke's University Healthcare Network in Pennsylvania.
Okay, great. So starting, I wanted to ask you, what assumptions do you encounter in the healthcare environment? And if so, do you consider these assumptions as a public health crisis?
It's a really good question. So I think that the assumptions I personally encounter or observe occurring is this assumption of a lack of health literacy. Um, of course, statistics have shown that immigrant populations are less likely to have graduated with a high school diploma, much less an advanced degree. So to an extent, we can understand where this assumption comes from. However, some of this also comes from the stereotypes that we have against immigrant populations of working shift hours or working multiple jobs or working in manual labor. And I think that all of these things compounded, a lot of times healthcare professionals um, assume that patients may not be aware of the long-term consequences of their behaviors, whether that's risky sexual activity, illicit substance use, or even something basic like healthy diet and exercise.
So, see,
And
yeah, sorry.
yeah, sorry, just to address your second question about the public health crisis, I think that if this is not already a public health crisis, I think it's going to become one. Just as, the number of United States born citizens stagnates and the proportion of foreign born citizens continues to increase. And so, both for the health and welfare of our communities and also for the workforce and the economy as our population ages, it's important to address this.
Definitely. So I wanted to ask, how do these assumptions impact the quality of care that this population would receive?
Yeah, that's another really good question. So I think that primarily it affects the patients themselves. When providers make these assumptions or um, even kind of require an interpreter to communicate with the patient, a lot of times you lose that doctor-patient relationship. For example, you may assume that, okay, this patient is non-compliant with their therapy because they just assume that they're health illiterate, which may not exactly be the case. And this might create a negative experience for the patient. I think that in some scenarios, this could be kind of looked at in a more positive light because we will do extensive testing, tests for workplace exposures or other exposures and other communicable diseases that we might not have looked for otherwise. But I think at times it can be insulting to the patient.
Definitely, definitely. Again, I want to thank you for answering these questions. Like I said, I wanted to keep it very brief as I know you're busy. So thank you, Dr. Priyanka Upasani, for joining me to answer a few questions on this topic.
You're welcome. Take care.
Bye-bye.